Hello and good afternoon friends, welcome to this CEC EduSet live lecture. Dear friends, with our ongoing series on medical diagnostics, today we would be talking on diabetes in our first session, whereas in the second half we would be discussing on hypertension. And for this very discussion on the two topics, we have once again with us in our studios Dr. Amit Bhattacharya. Dr. Amit Bhattacharya is Assistant Professor in Department of Zoology, Ramjas College, University of Delhi. So dear friends, let's welcome Dr. Amit Bhattacharya and let's try to understand more and more about diabetes and hypertension. Hello sir, welcome to the EduSet lecture.
Thank you very much. So in this part of the lecture, I will cover up the first chronic disease, which is called as the diabetes. So all of us know about the diabetes. It's a very common disease in India, especially in the Indian subcontinent. It's a very common disease. And what exactly diabetes is, how exactly it is caused, what are the various types of diabetes, what are the symptoms of diabetes, and then subsequently we will go into the diagnosis and treatment measures of this diabetes. So let's first take up what exactly diabetes or what's the definition of diabetes is. So diabetes is a chronic disease in which the insulin, which controls or regulates the glucose level, doesn't function properly. Either they are not produced or synthesized from the pancreas at the correct moments or regularly, or they are not being properly regulated through the insulin receptors and the carrier molecule. So diabetes are of various types depending upon what kind of mechanism is going around. So diabetes is a chronic disease which WHO says that occurs either when the pancreas doesn't produce enough insulin or when the body cannot efficiently use the insulin it produces. So basically insulin is a hormone that regulates the blood sugar level. So hyperglycemia or raised blood sugar level is the common effect of the uncontrolled diabetes, and over the period of time, if the hyperglycemia is not regulated properly, it may lead into the diabetic condition. So in the diabetes, majorly the nerves and the blood vessels get affected. In 2014, it has been estimated by WHO that 8.5% of the adults aged 18 years or older had diabetes. In 2012, diabetes was direct cause of about 1.5 million deaths, and high blood sugar was the cause of another 2.2 million deaths. So we can just see from the statistics how deadly this disease is. Now let's go into some of the key facts of diabetes. So the number of diabetes over the years have increased rapidly. So in the year 1980, it was estimated that about 108 million people were diabetic, but in the 2014 it has shown that about 422 million people have got diabetic. So the numbers have quadrupled. The global prevalence of diabetes among adults over the age of 18 years has risen from 4.57% in 1980s to 8.5% in 2014. Diabetes is much more prevalent and in a rising state in the middle and low income countries. So diabetes is a major cause of blindness, kidney failures, heart attack, stroke, lower limb amputation. Now, it is being estimated that in 2012, an estimate of 1.5 million deaths were directly caused by diabetes. So, the major things, it is being said by the WHO that diabetes will be 7th leading cause of death in 2030. Healthy diet, regular physical activity, maintenance of normal body weight, avoiding tobacco and alcoholic products, and are the various ways in which the diabetes can be prevented or delayed, especially the diabetic type 2. We will come into all these diabetes types one by one. Now, what are the various symptoms of diabetes? So the diabetes are having a number of varied symptoms which includes hunger, infection, excessive urine occurs, the fatigueness occurs, vision change occurs, thirst occurs. Now, what are the various diabetes related complications which can occur? The first one is called as the neuropathy, in which the nerves gets affected. Then the nephropathy occurs, in which the kidney failures or the kidney related disorders start taking place. Then the coronary heart diseases takes place, stroke, retinopathy where the eyes gets affected, peripheral vascular diseases are also one of the diabetes related complication which can occur. So all these are the complications which occurs because of diabetes. Now if we see the global statistics, it says that 1 out of 11 person is diabetic. So about 422 million adults have diabetes across the globe, and it has been estimated that about 1.5 million deaths are caused by diabetes and 3.7 million deaths due to diabetes and high blood sugar levels. Now there are various types of diabetes. The first type is called as the type 1 diabetes, where the body or the pancreas doesn't produces enough insulin. Then there is type 2 diabetes, in which the body produces insulin but it cannot utilize this insulin properly. And the third type of diabetes is called as the gestational diabetes, which is a temporary condition which mainly occurs in the pregnant women. Now the consequences of diabetes we just discussed are, it can affect the brain system causing stroke, then it can affect the eye causing blindness, it can affect the heart causing various coronary heart disorders. Then there are renal failures which can occur because of diabetes, mainly the kidney failures, and subsequently infections and the limb amputations can also take place because of diabetes. Now the major cause of type 2 diabetes, which is the most common and most prevalent diabetes, is the unhealthy diet, in which it has been said across the globe that 1 in 3 person is overweight, while physical inactivity is another cause in which it has been said that 1 out of 10 persons are obese. So we can just see obesity and overweight are two of the major causes of type 2 diabetes. Now what are the key actions that an individual can take is, he can eat healthy, lots of vegetables and fruits can be included in his or her meal, be physically active, avoid excessive weight gain, go for regular blood checkups and follow medical advices. Now we'll come into all these diabetes one by one. Before going that, let's have a brief summary of these diabetes. The type 2 diabetes is a chronic condition that affects the body processes, how it processes the blood sugar level from the blood circulation. Then the type 1 diabetes is a chronic disorder in which the pancreas stop produces or produces very little amount of insulin. Then comes the pre-diabetic conditions, which is the early stage of detecting a diabetes, in which the blood sugar levels are high in the blood composition but not high enough to be called as a diabetic. And the fourth one is called as a gestational diabetes. It is a condition where the pregnant women show a high level of blood sugar. Now before going into what the various types of diabetes, let's take up how exactly these insulins are produced and what's the function of these insulin hormones. So in our body there are some vital organs, of which one of the vital organ is the pancreas. So the pancreas is present, if we see the image over here, the pancreas is present along near the stomach duodenum part. So the pancreas have got specialized cells into it, which is called as the islets of Langerhans. These cells produces alpha cells and beta cells. These have got alpha cells and beta cells. So the alpha cells are the cells which are responsible for the secretion of glucagon, while the beta cells are the cells which are responsible for the insulin production. So insulin are the hormone which controls or regulates the glucose level within the blood circulation. So it decreases the glucose level from the blood circulations and keeps a control check on the blood glucose level. Then there are acinous cells also which are present, which secretes digestive juice into the pancreatic duct, which can be seen in this image. So the insulin production majorly takes place from these beta cells which are present in the islets of Langerhans. Now what exactly happens in the various types of diabetes? So in a healthy person, what happens is the pancreas regularly and constantly produces insulin hormone. So this insulin hormone, what it does is it binds to the cell receptors which are present on the top of the cell. As soon as they bind, they opens up the transporter, glucose transporter channels within the cell membrane. So as these glucose transporter channels are opened, the glucose gets into the cells from the blood circulation. So that's how the level of the blood sugar decreases and the glucose can be properly utilized by the cell's metabolism. Now in the type 1 kind of diabetes, where the pancreas fails to produce the insulin or produces very less amount of insulin, so the insulin is not produced, they won't be able to bind to the insulin receptors. As they won't be able to bind to the insulin receptors, so the glucose transporter protein channels won't open up for the glucose, and the glucose level will start increasing and accumulating in the blood circulation. So the blood sugar level increases by a number of factors. Now in the type 2 diabetes, what happens is the insulin is produced by the pancreas, the insulins are produced by the pancreas, but what happens is the insulin receptors are not so receptive about taking up or binding to these insulin hormones. So these insulin receptor doesn't bind to these insulin which are being produced by these pancreatic cell, beta cells of pancreas. So as they are not binding to the insulin, so the glucose transporter channels won't open up and the glucose won't be taken up by the cell, thereby the cell fail to respond to insulin properly, and due to which the glucose level start increasing in the blood circulation or the blood sugar level increases up. So these are the various types of diabetes and how they differ from each other. Now recently in 2016, the WHO on the occasion of World Health Day launched the global report on diabetes. So this is one of the first WHO report on diabetes which demonstrates that the number of adults living with diabetes has almost quadrupled since 1980 to 2014. So initially there were about 108 million cases, but in 2014 there were about 422 million cases of diabetes. So we can see how these numbers are increasing rapidly. Now if we see some of the statistics over here which are of India, so in India majorly the maximum number of cases of the diabetes deaths occurs between the age of 30 to 69, and we can see the figures in thousands in males as well as in the females. Now if we see the percentage proportional mortality of the total deaths which occurs in India, the majority of the deaths occurs because of the communicable diseases, maternal, prenatal, nutritional conditions. Then comes the cardiovascular diseases which comes up, then comes the respiratory disease, then the injury, other NCDs, cancer, and following them comes the diabetes. Now if we see the right hand side graphical representation over here, this representation shows the percentage of the population which has increased over the year and have become diabetic. So we can see the initially in the 1980s the percent was about 4%, but over the years in 2014 the percent has reached about 8 to 9%. So we can see there is a constant increase in the diabetic cases. Now if we see the prevalence of diabetes and the risk factors involved, we can see the diabetes of about total population 7.8% of India's population is diabetic, 21.4% of the India's population is overweight, 4.7% of the India's population is obese, and about 12% of the people don't have a regular physical activity. So these are the various conditions which leads to the diabetic condition. Now we come up into the first type of the diabetes, which is also known as the insulin dependent juvenile or childhood onset diabetes. So this is majorly characterized by the deficiency of insulin productions and which is required in a normal day-to-day routine life body works. So the insulin production doesn't takes place properly from the pancreas, and there is little or no insulin productions which takes place. So the cause of diabetes type 1 is still it's not clear actually, and it is not preventable with the current knowledges. Now the various symptoms of type 1 diabetes is just like the type 2 diabetes. Excretion of urine, there is excessive excretion of urine which is called as polyuria, thirst which is called as polydipsia, constant hunger, weight loss which occurs, vision changes, fatigueness which occurs. These symptoms may occur suddenly also. Now if we see the diagrammatic representation over here, this diagrammatic representation shows the beta cells of the pancreas. So we can see in a healthy individual, the beta cells secretes the insulin, and these secretions are then loaded into the bloodstream for the proper regulation of the glucose level. But in a person who is affected with diabetes mellitus type 1, what happens is these beta cells are not efficient enough, or they have got killed or died over the years, and this insulin producing cells have got destroyed. So these insulin producing cells have got destroyed, and the insulins are not produced. So there is no, in the blood circulation there is very little or almost nil insulin. So what happening is the blood glucose level is increasing over the years. So type 1 diabetes is less common than type 2 diabetes. The major reasons of type 1 diabetes is still not clear, but it is being said that it may occur due to viral infections, especially mumps, rubella, and the other infection diseases which may lead to the destruction of the beta cells. Then there are genetic predispositions which have been also related to the type 1 diabetes, and autoimmune inflammations also causes type 1 diabetes, in which the islets of Langerhans cells get destroyed because the cell antibodies are produced within the body. So there is an autoimmune infection which is occurring over here. Now let's come into the next type of the diabetes, which is called as the type 2 diabetes, which is many a times referred as the non-insulin dependent or the adult onset. So type 2 diabetes is much more prevalent than the other types of diabetes. In this type of diabetes, the pancreas produces insulin, but what is happening is this insulin cannot be properly channelized or routed into the proper way. So the cells cannot use this insulin properly. So there is uneven usage of this insulin, which is leading to the increase in the blood glucose level within the bloodstream. So that's the type 2 diabetes, which is much more common in this. The similar symptoms can be seen in type 2 diabetes, just like the type 1 diabetes, which includes excessive urination, thirst, there is constant hunger which occurs, then there is fatigueness which occurs. So all these are the common symptoms of type 1 and type 2 diabetes. Now if we see the image over here, this shows the type 2 diabetes and how does it occur. So in the type 2 diabetes, which is many a times referred as the insulin resistant, so in this type of diabetes what happens is the insulins are produced by the pancreas, but the insulin goes and binds to the receptor, but the receptors becomes non-responsive. So as the insulin receptors become non-responsive, so they cannot be activated, and they cannot go and activate the glucose transporters also, which are shown over here. As these glucose transporters are not activated, the glucose cannot be taken up from the bloodstream into the cells for its utilization. So as a result, what is happening is there is a regular increase of glucose level in the blood streams. So type 2 diabetes also has got which causes a higher increase of the blood glucose level, but it is completely different from type 1 diabetes, because in this the insulins are produced, but the insulins cannot be properly utilized by the cells because the insulin receptors doesn't functions properly, or it cannot activate the glucose transporters properly. Now if we see the main symptoms of diabetes, the symptoms of most of the symptoms are similar for type 1 and type 2. Some of the symptoms which are shown in blue in color are more common in type 1 diabetes. So these includes the polydipsia, then there is lethargy which occurs, there is weight loss which occurs, respiratory problems occur, the vision blurriness start taking place. Then in the breath there is a smell of acetone which occurs, gastric problems start occurring like the nausea, vomiting, abdominal pain. Then over the period of time, urinary infections can also occur. The kidney also get affected by these things. So there is polyuria or excessive urination which also occurs. Now, the type 2 diabetes, it mainly causes a number of diseases. So the first one is called as the encephalopathy, in which the brain cells are affected. Then the diabetic retinopathy can occur, in which the eyes or the eyesight is affected in the diabetic patient. Then the diabetic cardiomyopathy occurs, in which the heart problems start taking place or the coronary heart diseases start taking place. Then there is diabetic nephropathy, in which the kidney gets affected by these things, diabetic condition. Then there is periodontal diseases, in which the teeth and the dentures the teeth get affected in the diabetic mellitus type 2 patients. Now, there is third type of diabetes which is called as the gestational diabetes. Gestational diabetes is basically a hyperglycemia, in which the blood glucose value increases above the normal, but they are not at a value in which we can say that the patient has gone into a diabetic condition. These generally occurs during the pregnancy. So a woman with gestational diabetes are at a high risk of complication during the pregnancy and at delivery. And subsequently it has been found that they and their child are also at an increased risk of developing type 2 diabetes in the future also. So prenatal screening and proper screening of these diabetes is very necessary during the pregnancy conditions. Now, if you see the image over here, this image shows how exactly it happens. So, in a pregnant mother, there is a high blood glucose level which occurs, and this extra glucose is taken up by the baby, which causes the baby to put on extra weight, and complications can occur over a period of time. So it has to be diagnosed properly and treated properly so that the complication doesn't occur during the pregnancy or the delivery cases. Now, impaired glucose tolerance and impaired fasting glycemia are also a cause of progression into the type 2 diabetes. So impaired glucose tolerance and the impaired fasting glycemia are the intermediate conditions which are the transition state between the normal and a diabetic person. So if a person is showing a impaired glucose tolerance and impaired fasting glycemia, then he or she should be diagnosed properly, because there are chances that the person can get into or lead into type 2 diabetes over in the future. Now, what are the various values or the blood sugar levels which needs to be monitored in the blood? So, randomly it has been said that in a normal individual, the blood glucose level should be below 200 mg per dl, while in the diabetic patients it is generally in a random condition, it is 200 mg dl or more. In the fasting conditions, in the normal persons, the diabetes, the blood glucose level is about 108 mg per dl, and in the diabetic patients it is about 126 mg dl or more, and in the postprandial 2 hours, after 2 hours of meal, in a normal person the blood glucose level should be below 140 mg per dl, while in a pre-diabetic it should be between 140 to 199, while in a diabetic case it is generally more than 200. So in a person who is normal, generally while the fasting, the blood glucose level should be between 72 to 108 mg per dl, while in a diabetic patient in fasting the the condition should be lower, while eating, after eating or 2 hours post eating, the blood glucose level in a normal person should be about or below 140 mg per dl. Any values above this one are giving us the indication that the person might be in a pre-diabetic state or in a diabetic state. So the person having any values above these ones or between these ones should immediately report to the doctor and gets the treatment at the earliest possible way. Now, what are the various common consequences of diabetes? So, diabetes can damage the heart, blood vessels, eye, kidney and nerves. So, the person who are diabetic, they are said to be about 2 to 3-fold increased risk of heart attacks and stroke. Then there is neuropathy or the nerve damage which occurs mainly in the feet area. It causes the increase in the foot ulcer, infections, and eventually the patient might need a limb amputation also. Diabetic retinopathy, in which the eyesights are affected, is also one of the leading cause of problem in the diabetic patients. It causes blindness, and in a long term, if it is not treated properly, it may lead into complete blindness also. So, about 2.6% of the global blindness has been attributed to diabetic condition. Now, the diabetes is among the leading causes of renal failures or the kidney failures also. Now, what are the various prevention measures which can be taken up? So, the first prevention measures is we should have a proper healthy body weight, height is to body weight ratio should be proper. We should be physically active, at least 30 minutes of regular or moderate intensity activity should be done on most of the days. Eat a healthy diet, avoid sugars and saturated fats intake. Avoid tobacco use because smoking increases the risk of diabetes and cardiovascular diseases. Now, what are the various diagnoses and treatments which are available? So, there are various means by which we can diagnose or detect the diabetic conditions. One of the way is the use of the glucometers. So, these diabetic conditions can be checked with the help of the glucometers. So, this is the image which is showing how we can use a glucometer. So, the blood sample random fasting or after the food intake can be taken up. So, they are put onto the strips which are readily available, and these strips are then inserted into the glucometer, which gives us the result in a fraction of seconds, and we can then compare these results with the standard range which have been released by the WHO or the various government organization, and then we can say whether the person is into a normal range or pre-diabetic or a diabetic range. So, that can be quantified through these blood glucose testing levels. Then there are various other medicines which are available over here. So, these medicines are regularly recommended by the doctors where they feel that the patient is having a high sugar level. So, a healthy diet is generally recommended. Physical activity and avoid of excessive weight gains are the various preventive measures which the doctors generally recommend a patient during the diabetic condition. Then there are various drugs which are available in the market. The oral medications are given, but if with the help of the oral medications the blood glucose level is not below the general limit or the control limit, then the doctor recommends the use of the insulin, which are the artificial hormones which are available in the market. So, insulin doses are given to the patient, especially in the case of the type 1 diabetes where the insulins are not produced by the pancreas. So, the doctor recommend proper doses or standardized doses of insulin to that patient so that the insulin level can be regularly present in the blood circulation and they can regularly monitor the glucose level over there. So, there are various oral medications as well as these insulins are produced. Along with that, there are various preventive measures which are available. So, with all these things, the diabetes can be regularly controlled and measured in a regular way. So, the best way to prevent the diabetes is to have a regular proper diet and regular activity or physical activity. So, with this note, I end the first part of the lecture. Thank you very much. Good afternoon, dear viewers. In this Welcome to the lecture on medical diagnostic. In this part of the lecture, I will be talking about hypertension. So, in this hypertension topic, we will first cover up what exactly hypertension is, what are the various causes or symptoms of hypertension or high blood pressures, and what are the various means through which it can be released or it can be prevented over the ways. Now, hypertension basically means the raised or high blood pressure. So, as we know that the blood flows across the body through the blood vessels. So, whenever there is an increased level of pressure which these bloods does to the blood vessels, they leads to a hypertension. So, as this high blood pressure occurs, what is happening is the heart has to pump a extra mile to circulate the blood across the body parts. So, hypertension is a very common disorders nowadays, especially in the urban area. So, the latest figures by the various government agencies says that 1 out of 3 person across the globe or worldwide is suffering from hypertension or high blood pressure. So, the WHO has defined hypertension or high blood pressure as the high or raised blood pressure, which is a conditions in which the blood vessels have persistently raised pressure. So, the blood, we know that is carried from the heart to all parts of the body through these blood vessels, and each time the heart pumps these things and it pumps the blood into these blood vessels. Now, the blood pressure is basically created by the force of blood pushing against the walls of the blood vessels, mainly the arteries, as it is pumped by the heart. So, the higher the pressure, the harder the heart has to pump. So, we can understand how the heart proper functioning is changing because of the hypertension. Now, the hypertension is a life-threatening disorder, especially if we take up the Indian subcontinent scenario. So, the hypertension has been said to increase the chances of life-threatening complications. The high blood pressure, the higher is the likelihood that the harmful consequences may occur to the heart and the blood vessels and other major organs such as the brains and the kidneys. So, the person who is suffering from hypertension has got a chances that he or may suffer from heart attack, stroke, or there may be renal or kidney failures which may occur, then the brain strokes may also occur. So, there are a number of related organs which may get affected because of hypertension. Now, the various risk factors basically includes the tobacco use, physical inactivity, unhealthy diet, obesity, diabetes, high cholesterol, and the low socio-economic status and the family history of hypertension. So, all these are the causes of hypertension, and the persons who are having some of these symptoms or can get a hypertension or high blood pressure. Now, what exactly the blood pressure means? So, it is the pressure that our blood exerts against the arteries which carries the blood across the body as it is pumped through our body by the heart. So, this is the pressure which is applied by the blood to the artery walls. Now, the pressure in the arteries increases when the heart beats in a higher way, and it decreases when it is in the resting state. Now, if we see the diagrammatic representation over here, there are two pressures which are generally calculated in a beating state. So, one is called as a systolic pressure, which is measured when the heart contracts, and one is called as the diastolic pressure, which is when the heart relaxes and between the two beats. So, the systolic and the diastolic pressures are calculated in each of the readings of taking up the blood pressure. So, in a normal person, the blood vessels are properly formed and properly oriented, so the blood flows regularly. But in a pre-hypertension and a hypertension, we can see that the blood vessels narrows down. So, there is a pressure which is created over there because there is lesser amount of surface, free surface area through which the blood can flow, and the blood pressure increases. Now, worldwide, it has been said that 1 out of 3 adults has got high blood pressure, a condition that can lead to heart attack and stroke. Everyone can take 5 concrete steps to prevent this high blood pressure. First is the healthy diet, then physical activity, avoid tobacco, avoid harmful use of alcohol, and the fifth one is managing the stress in a healthy way. So, what are the various causes we just discussed? First is the stress, the second one is the obesity, third one is the diabetes, fourth one is the age related factors, fifth is the hereditary, sixth is use or consumption of excessive salts in our food, then comes the unhealthy diet, alcohol consumption and smoking. So, all these are the causes of hypertension through which the high blood pressure can occur. Now, WHO recently released its global book which says the global brief on hypertension, well, all the facts and figures of hypertension across the globe has been mentioned. So, you can just log on to WHO website and get this book downloaded and can read what are the various symptoms, what are the ways through which it can be prevented, what are the precautions one can take so that he doesn't go into the hypertension or high blood pressure condition. Now, WHO in this report has said that approximately 17 million deaths every year occur because of cardiovascular diseases, mainly high blood pressure. So, this relates to about 1/3 of the total deaths which occurs across the globe. So, the complications of hypertension accounts for about 9.4 million deaths worldwide every year. Now, hypertension is responsible for at least 45% of the death due to heart diseases and 51% of the deaths due to stroke. So, we can see the heart related disease increases much more because of the hypertension or high blood pressure. Now, before going into what exactly are the types and the various forms of high blood pressure, let's discuss what exactly blood pressure, how does the blood flows across the body. So, blood is carried from the heart to the various parts of the body through the blood vessels, and each time the heart beats, it pumps the blood into the vessels. So, blood pressure is basically created by the force of blood pushing against the wall of blood vessels, mainly the arteries, as it is pumped by the heart. So, the hypertension is also known as the high or raised blood pressure, where the blood vessels have persistently raised pressure. So, we can see over here the blood vessels are having a higher raised pressure onto them because of the flow of the blood. So, now the higher the pressure in the blood vessels, the harder the heart has to work in order to pump blood. So, what is happening is because of the hypertension, the heart has to work additionally or in a faster way. So, that is causing damages to the heart and the heart related blood vessels and the capillaries. So, now there are various conditions which can occur because of this high blood pressure. One of the major condition is called as the stroke. So, the pressure in the blood vessels can cause the blood to leak out from the brain, and this may lead to stroke. So, hypertension can also lead to kidney failures, blindness, rupture of blood vessels and cognitive impairment. Now, what are the various complications which persist because of high blood pressure? So, they can occur in the brain where there is cerebrovascular accidents or the strokes which can occur. Then there is encephalopathy which can occur, means the confusion, headache and convulsions can occur. Then the elevated blood pressure level can causes elevated sugar levels. The patient who are having high blood pressures can have the diabetic conditions also, or vice versa. Then there are retina of the eye also get affected. There is hypertensive retinopathy which may occur in the high blood pressure patients. Then there is myocardial infarctions, which is basically the heart attack which may occur. Then there is hypertensive cardiomyopathy or the heart failure which can occur, and kidney failures or the chronic renal failures can occur in the high blood pressure patients. So, these are the various organ or the vital organs which get affected because of the high blood pressure. Now, what are the major types of these hypertension? The first type is called as the primary, the second one is called as the secondary. So, the primary hypertension or the essential hypertension is the most common one. It is the cause of the hypertension. The exact cause of this hypertension is not known. The majority of people with this type of hypertension have no different symptoms from the normal blood pressure, so it cannot be detected or diagnosed at the early level because the symptoms are no different from the normal blood pressure condition. While the secondary hypertension occurs because of some medical problems or medications in which the kidney or the liver cells get affected. Now, if we see the classification of blood pressure for the adults, in the normal, the systolic blood pressure should be about 120 or less than 120, while the diastolic blood pressure should be about 80 or below 80. Now, in the pre-hypertension condition, the systolic pressure should be between 120 to 139, while the diastolic it should be between 80 to 89. In the stage 1 of hypertension, it should be between 140 to 159, while the diastolic should be between 90 to 99, while in the stage 2, it should be around 160 or more than 160, or the diastolic blood pressure is about 100 or more than 100. So, these are the various classification of blood pressures and which needs to be checked. Now, the hypertension is further classified into various stages which we discussed, the stage 1, stage 2, stage 3. The stage 1 is the occasional or intermediate blood pressure elevations which occur, while in the stage 2 there is sustained blood pressure elevations which occurs, and in the stage 3 hypertension it results from a marked and sustained BP elevations which occurs. Now, if we see the diagrammatic representation over here, this shows the blood pressure, how the systolic and the diastolic pressure should be. So, in optimum or in normal condition, it should be between 80 and 120. So, 80 is the diastolic while the 120 is the systolic, while in the high normal it should be about 140 to 90. In the grade 1 hypertension, which is the mild, the BP should be 160 to 100. In grade 2 hypertension, which is a moderate, it should be about 180 to 110, while the grade 3 hypertension is more than 180 and more than 110. So, these are the various blocks or the parameters in which the hypertension have been graded according to the readings. Now, what are the various causes of hypertension? So, there are various behavioral risk factors which are involved. So, consumption of food which contains too much salts and fats should not be preferred, and eating lots of fruits and vegetables is generally recommended. Then there is harmful effects of the alcohol uses and the smoking. Physical inactivity and lack of exercise can also lead to hypertension. Poor stress management can also lead to hypertension. So, all these are the behavioral risk factors which highly influence the people's working and living conditions. So, over here we can see a map which shows that how these behavioral risk factors are related to the metabolic risk factor and subsequently to the cardiovascular diseases. So, there are various behavioral risk factors like the unhealthy diet, tobacco uses, physical inactivity, harmful use of alcohol, which are related to the social determinants such as the globalization, urbanization, aging, income, education, housing. Now, these are related further to metabolic risk factors and lead to metabolic risk factors such as the raised blood lipid level or high cholesterol level, diabetes, obesity, and high blood pressure. Now, these high blood pressure, obesity, diabetes, and the high cholesterol level can further lead to various cardiovascular diseases such as heart attacks, strokes, heart failure, or kidney ailments such as the kidney or renal failures also. So, all these things are interrelated to one another, what we can see from the diagrammatic representation over here. Now, if we see the global map over here, this global map shows the prevalence of raised blood pressure of the people who are above the age of 25 years. So, both the sexes are shown over here. This is a map of 2008 released by WHO. So, over here the yellow area are the percentage prevalence between 35 to 39.9% cases. So, we can see the yellow area is majorly present in the Indian subcontinent and the adjoining area, while the red area shows that the population, 50% of the population is having raised blood pressure. So many parts of the Africa are showing the high numbers of raised blood pressure in the standard age of 25 or above. Now, if we see the heart disease mortality rates across the globe, we can see the major heart-related mortality deaths are in India and large parts of the Europe, which is there. Then the some parts of the Africa is also there. So the red portion shows the majority of the part which reports the maximum number of heart-related disorders and mortality. Now, there are cerebrovascular diseases or the heart and blood vessels related diseases and conditions which are reported from number of countries. So they are majorly present, the countries which are reporting the maximum number of cases are shown in red in color. So they are majorly located in the European countries and the African regions, while India also shows a large number of cases which are related to the cerebrovascular disease mortality rates. Now, this bar diagram shows the age standardization prevalence of raised blood pressures in adults above the age of 24 years. So it has been divided into the various regions designated by WHO. So the African region is showing the maximum number of cases, then comes the region of America, Eastern Mediterranean region, European region, Southeast Asia region, Western Pacific region. So all these regions are shown, and the bar diagram on the right hand chart shows the lower income, lower middle, upper middle and high income group. So we can just compare how the number of cases are changing across the various regions and the sexes depending upon the regions as well as the socio-economic zones. Now, the projected mortality trend from 2008 to 2030, which has been predicted by WHO, shows a number of chronic disorders which includes cardiovascular diseases, cancer, diabetes, perinatal conditions, maternal conditions, chronic respiratory diseases, tuberculosis, malaria, HIV, AIDS. So we can see the maximum number of cases have been reported from cardiovascular diseases, then comes the cancer, then comes the chronic respiratory disorders which comes, then comes the HIV, AIDS and subsequently the other cases. So over a period of time we can see the number of cases have increased from 2008 to it will increase to 2030. Now, what are the essential hypertension causes? So use or consumption of excessive salt is one of the causes. Then there is abnormal arteries which is related to hypertension. Increased blood volume is one of the reasons. Genetic disorders and stressful life. The secondary hypertension causes are mainly because of health conditions, certain medicines, recreational drugs which are there, pregnancy which is there and hormonal therapy. Now, the various symptoms of high blood pressure. So the various symptoms of high blood pressures are headache, shortness of breathing, dizziness, chest pain, palpitation of heart and nose bleeding. So these are the various symptoms which are shown, and many a times these symptoms get unattended, goes unattended, and the person goes from the pre-hypertension condition to a hypertension condition grade 1, grade 2 subsequently. So most hypertensive people have no symptoms at all. So it's very hard to check whether the person is having any hypertension. So it's better to check our blood pressure after the age of 30 years regularly, so that we can get an idea that how if we are suffering for hypertension or high blood pressure condition. Now, the hypertension is also related to one of the very major disorders which is a cardiovascular disease which is called as atherosclerosis. Now, hypertension leads to oxidative stress, and subsequently this oxidative stress relates to atherosclerosis, and atherosclerosis then subsequently goes into cardiovascular or the blood vessels related disorders. Now, we know that the arteries are the blood vessels that carry the blood from the heart throughout the body. So there are two major arteries which are present. One is called as the coronary arteries, which provide blood to the heart, and the other one is the carotid artery, which supply blood to the brain. So these blood are passed through these tiny blood vessels which are known as the capillaries, where the oxygen in the blood is transferred to the cells, and the deoxygenated blood then returns back to the heart for proper circulation. Now, what exactly is atherosclerosis and arteriosclerosis? In the atherosclerosis, what happens is there is accumulation of lipids in the blood vessels. So in the blood vessels, the lipids start getting formed. So we can see over here the atherosclerosis, the lipid layers start getting formed. So there is a plaque which gets formed in the inner side of the blood vessels, due to which the blood flow doesn't take place properly and the blood pressure increases. In the arteriosclerosis, what happens is there is stiffness which occurs, and the thickening of the inner wall and the central wall of the arteries which occurs. So the inner and the central wall increases, so the lumen size decreases, due to which what happens is lesser amount of blood can flow through these blood vessels, causing increase in the blood pressure level. Now, hypertensive arteriosclerosis is a progressive increase in the muscle and the elastic tissue of the arterial walls, which results in chronic high blood pressure. So we can see over here the muscle in the elastic tissue of the arterial wall have increased, due to which the lumen size has got decreased down, and the blood pressure is putting extra pressure on the arterial walls, increases the blood pressure level. Now, what are the various ways in which the blood pressure can be controlled? Now, the blood pressure can be controlled by various ways. So there are various ways through which this blood pressure can be controlled. The first one is the consumption of the healthy diet, which specially includes the potassiums and fibers, high in potassium and fiber content. Then the plenty of water should be consumed during the day. Then regular exercises should be done. The smoking should be avoided in the patients who are suffering for blood pressure, or the persons who have been reported with the pre-hypertensions. Then there should be limitation in alcohol consumptions in the patients. Limit the salt consumption per day. It has been recommended about 1500 mg per day of salt consumption should be done. Try to avoid stress and maintain a healthy body weight condition. So these are the various ways through which a person can get rid of the hypertension, and this hypertension can be prevented at the very early level. So because it has been seen that this hypertension many a times leads to a number of other chronic disorders such as diabetes, renal failures, cardiovascular diseases, heart attacks, strokes, and many others. So if the hypertension can be prevented at the very early level, it can be checked and it can be properly diagnosed. So with all these things, the hypertension can be checked. So in this part of the lecture, we discuss about what exactly the hypertension is, what are the various grades or types of hypertension, what are the preventive ways through which this hypertension can be checked, and what are the standard reference levels or the standard readings which the WHO and the other government agencies which have declared as the normal hypertension grade 1, high BP grade 2, and subsequently the other grades. So with this note, I end my lecture over here. Thank you very much.
With this note, thank you, sir. Thank you so very much for giving us a very, very productive session on hypertension. Dear friends, we believe that if you have any queries, then you can mail us at info.cc@nic.in. Sir, as we have some few minutes left over here, we talked on the two diseases together, that is diabetes and hypertension. As per the rates, if we talk about in India alone, are very high in both the cases. So the only objective of asking question is what to do and what not to do.
Okay, so the first and foremost, actually both these diseases are many a times referred as the silent killers. So a person doesn't know that he or she is suffering from pre-diabetic or pre-hypertensive condition, but he is getting all these conditions within his body things. So a proper regular body checkup should be done after an age of 30 years. It has been generally recommended nowadays that once you reach the age of 30 years, a proper diabetes, the fasting and the fasting, and after the regular diets, the diabetic condition or the blood glucose level should be checked, and BP should be checked after every 1 or 2 months, so that you can know that in which particular category you fall. So if there is any increase or slight increase in these levels, you can immediately consult the doctors or consult the various physicians, so that you can diagnose with the things. So at the initial level, all these conditions can be controlled by the various exercises. Then there are various stress management programs such as the yoga, and all these things are there. Then there are healthy proper diets which are being recommended to the patient, so that the things can be done. So, and moreover, there are oral medications which are available in the market. So if these things are checked and diagnosed at the early level, smaller amount of oral medication dose are generally given, so they can be checked at the early level. But if they increases to a certain level, just in the case of the suppose in the case of the diabetes, if the blood glucose level go beyond 200, 250 regularly, so the doctor generally recommends for insulin injections also. So that's the only way or the only mantra for the to control these things is to have a proper healthy diet and regular exercises, at least 30 minutes per day or after an interval of days. So that's the only thing what I can say.
Definitely, as it is always said that prevention is better than cure. Definitely, we should go for regular checkups, and we should plan our diet as Dr. Amit Bhattacharya himself said. So dear friends, we would be meeting again tomorrow, and would be talking on another diseases under the topic, under the series medical diagnostics. Till then, take care, goodbye, and yes, we would be uploading this lecture on YouTube for you. So keep watching us and keep writing us. Thank you, sir. Thank you so very much.